Good morning, everybody. We are here on the day 3 on the opening panel, kicking it off on the topic of health and wellness. And together here in the studio, unfortunately not in the studio with me, but over the Zoom, we have Darlington Akago, then we have Anne Rains, and then we have Samir Abdelkrim. Darlington is the lead of AI for radiology at the UN, and as a commercial director of the Abidjan and Together for Her, and Samir is the founder of Emerging Valley. I would actually like to give 2 free minutes to each of you. I know it's also early morning to some of you. Thank you for being here on the Saturday morning. Hope you have your cup of coffee and hope it's going to be a good conversation together with me and with all of you. And just a heads up, Darlington is also a hackathon participant, as we found out later. So he's also competing. So yes, we're going to hear some insight on that. But Samir, would you like to start? Just a few words about yourself and what do you do and what connects you to the health and wellness?
Yes, for sure. Thank you very much for inviting me. So I am Samir Abdelkrim. I am an entrepreneur. I am French, originally from Algeria. And after living and growing in Marseille, I have decided to travel the innovative African ecosystems between 2013 and 2017 to explore the digital startups of 25 African countries. So I did quite a lot of research on that topic. And I've met with hundreds of startups, incubators, and I wrote a book published in 2018 about digital startups in Africa named Startup Lions. I'm sorry, just in French right now, and which had quite a lot of cover in the French press. And when I was back in Marseille, which is my hometown, in south of France in 2017, I have created Emerging Valley, which is a platform and an international summit which gathered innovators from European Union, the Mediterranean, and the African continent. And I'm very happy to be here because we will cover for our next edition the topic of healthcare, and especially what was the response of African tech ecosystem and healthcare startups in the wake of the COVID pandemic, and how the startups are fighting back hand to hand with the local communities and governments against the COVID-19 on the ground. I just went back from Senegal and Egypt. I was a few days and weeks ago, and I've seen many examples of this kind of innovation. And this is what we will share during Emerging Valley and connect with the European and African stakeholders also on that topic.
Thank you so much, Samir. We will touch later on Emerging Valley and what you guys are doing again. But next on the lineup, Anne.
Yes, thank you so much. Hi everyone, my name is Anne. I'm originally from the Netherlands, right now in the Netherlands during COVID, but usually in India. I have a digital healthcare background, worked in healthcare for the last 6 years now in multiple countries in Europe and the United States, and now in India and Europe, where I'm basically responsible for the commercial side of digital healthcare startup, or by now it's a bit of more of a scale up. And what we do is we have a healthcare platform that is launched in multiple countries in multiple therapeutic areas, such as maternal health, HIV, tuberculosis, cardiovascular health. And we really support patients and healthcare providers to provide better care, to improve quality of life, and of course now during COVID, to continue providing care, which obviously is a big struggle in the last few months. I'm very passionate myself about female healthcare as well, and equality in healthcare, bias in healthcare is some of the passion topics that I'm working on specifically. And of course, in that middle between, like, how can you, of course, use digital healthcare in developed markets where maybe a lot of people have access to smartphones and to healthcare ready, but specifically, how can you then translate that to developing countries where maybe the struggle is a little bit different, but nevertheless much more needed often? So yeah, that's kind of that space between bias in healthcare, making healthcare accessible to everyone. That's where I try to operate. So I'm very excited to be here today, and hope that I can share some learnings and also learn from all the great work that is going on in the last few days at Hackathon.
And what connects you to the healthcare? Obviously, your title already is a bit self-explanatory, but still, go ahead.
I'm sorry, we missed you for a moment. The sound was
gone. All right. Yeah. Sorry. Darlington, floor is yours. Few words about yourself, please.
Oh, okay, sure. So, hello everyone. Nice dog, by the way. I'm just realizing. So, I'm the founder and executive director of Mino Health AI Labs. So, I work in healthcare across two different directions. So, from the industry point of view, we develop AI solutions for healthcare, but also we engage in research across many domains that have to do with using AI and data science, trying to address health challenges. But I also work from the regulatory as well as policy end. So I'm involved with the ITU and then World Health Organization's focus group on AI for health. I'm the lead of the topic group on AI in radiology.
Actually, back to the main gallery view so I can see all the speakers again here on the stage as well. Yes, so Samir already talked about it, kind of like opened up the question already and opened up the discussion a little bit. But yes, because it's health, the topic is health, the strong focus will also be on the COVID-19 on this topic. And what I wanted to ask is, I think in the beginning of the pandemic, there was lots of talk, at least, that's how this this sort of whole event or whole program reached to me, was the worry about Africa. Like, how is Africa going to bounce back from the COVID-19 and all of that? But in fact, it has been more resilient than predicted, right? Samir, would you like to open up on that? What has changed and how was it?
Yes, definitely. I can talk. For example, if you, at the very beginning last spring, if you look at the media in France, for example, it was quite scary. It was very pessimistic. Brought back us to the Afro-pessimism we have seen decades ago about the continent. But on the ground, I have to say that it's a great lesson actually given by the African entrepreneurs and African continent to the world, and of course that usual medias have forecasted kind of apocalypse for Africa with the COVID-19, and they were wrong. What describes best the African tech response and what we have covered, and we publish many articles on Startup-Bricks, which is our blog, more than 400, is that the innovation that comes from the ground is an innovation I would call organic, because it's especially it goes for the concrete needs of the everyday life, and this is a very specific feature of African startups. I would say that African entrepreneurs, in face of the COVID-19, they use concretely the power of digital innovation by creating solutions to hack the progression of the virus, by helping cut of the chains of transmission. And we have many examples. I will give you just a few. First, at the very beginning, hackathons were organized just like the one you're organizing today in Estonia. And from the very first hackathon and coding marathon, aiming to develop application in few days to hack the virus. One of the first, by the way, was named Hack for Wuhan, during which African startups were present. And the winner was a Burkina Faso-based startup named DiagnoseMe. But just after, in Lagos, in Abuja, in Nigeria, in Morocco, with the COVID hackathon, in Tunisia, with the health tech challenge, many hackathons took place digitally, and they gathered a large numbers of developers that co-create together solutions. Second, the application that were developed to track down the COVID-19, one of the most inspiring, actually, and impressive example is a Kenyan application named Ushahidi, which means witness in the local language. And this application help actually people to help each other and to take care to each other. And it was used during the lockdown in Europe, in Italy, and in Spain to report vulnerable and isolated people and allow them to benefit from the supply of medicines and food during the period of lockdown. Another examples in Yaoundé, in Algiers, in Abidjan, in Lomé, e-health startups that have developed specific features dedicated to COVID-19 to inform, to reassure, to protect citizens while relieving congestion in health services. And for example, in Algeria, and this is one of the startups we are working with right now, because we just organized a bootcamp 2 weeks ago, focusing on the Mediterranean, emerging Mediterranean. Branco, this Algerian startup, has developed a mobile application for self-diagnosis and the follow-up of COVID-19 cases. The application is named FAS, which means Auskult in Arabic, and it's already developing a partnership with the local government. And there are so many. In Renda, you have the COVID-19 Renda solution that offers individual self-diagnosis without the need to connect to the internet. It can work offline. And also, it's very important point about what innovation can provide to local hospital services is the emergence of application dedicated to improve the logistics. Technology has been very helpful to enhance the logistics and management of the pandemic at the national scale. For example, you have the Flare startup in Kenya, which is the solution is positioning the country's ambulances on a map in real time, so that the patients can be moved quickly to care. And it's also offering training to nurses. It's providing equipment, and it has so far in Kenya to 600 nurses. So, and it comes from entrepreneurs. So I can talk about Tunisia with GoMyCode. In Ghana, we have M-Pharma. Probably Darlington knows M-Pharma with Gregory Roxon. We know him and we follow him since 4 years now. And M-Pharma is a startup based in Accra that provides and supplies medicines to African medical facilities. And it allows doctors to program the COVID-19 tests for their patients, and then they receive the test a few hours after in a very digital and easier way for local facilities. So there are just very few examples. I have not mentioned what the makers are doing, the maker community, by creating gels, masks, respirators in their fab lab, with using a print farm. And we have seen that in the University of Pretoria, in Congo, in Algeria, in Morocco. So I would say that, and the first beneficiaries are the governments actually, and the health services. So I would say that the response from the ecosystem to the COVID-19 has been very fast, it's very useful. and it's not going to stop. So I'm not that pessimistic regarding the situation.
Yes, so many good tech examples given. You already said that, you know, tech really like this entrepreneurial crowd, and tech is sort of reacted quite quick, and there started popping up all these hackathons, and it seemed to be like, especially I think in the beginning, people had this like a rush to go and help and create something and find a solution.
Yes.
I think just because you already spoke on the tech examples, Anne and Darlington, do you also have some of your favorite tech stuff that happened during the COVID-19? Perhaps like just an app you are using at the moment for COVID-19 or something else. Doesn't have to be tech, just a reaction to COVID-19. And
Yeah, so,
can we begin?
okay, yeah, Anne can
Yeah,
go.
or Darlington, you, whatever.
No,
Yeah.
Darlington, go ahead. Go ahead.
It's quite hard
So I
to
just
moderate.
wanted, right. So yeah, that was a very that was a really good list. So I could just add a bit of what we've also done. So in the early days when you had a lot of dashboards that like the John Hopkins dashboard, and you were covering data from around the world, there wasn't any targeted data as far as if you wanted to understand the continent of Africa. So we created a COVID-19 dashboard targeting, sort of, we called it AI for COVID-19 in Africa. So we tracked the different cases in the various African countries and did a lot of analysis as well as projections when it comes to the rise of the cases, death, and the recovery. So we did that for months until WHO Africa and then the CDC Africa offices started their own dashboard, and then we kind of didn't see the need to keep it going since they are the right authorities to have it. But in the beginning, there was nothing like that, and so we ended up doing that. We collected a whole lot of data to be able to keep this dashboard running. We also ran a hackathon where people were, we have a community under our training program called Run Miller. So we had our community members develop AI systems that in an attempt to diagnose COVID-19 related conditions or COVID-19 related damages to the chest. So you use chest scans from either CT scans or X-rays, but then you are not detecting COVID-19, you are detecting COVID-19 related damages. This in itself is an important point that we might get into later. So we did this, and later on, we also worked with Zindi Africa to run a challenge, but this time we took a different angle. As COVID-19 is rising in Africa, as you've clearly stated, the damages that COVID-19 has caused, especially when it comes to death and hospitalization, is way lower than expected. However, other conditions like tuberculosis are very much on the rise, and tuberculosis is also a respiratory condition, and in a lot of sense can at the surface be confused with COVID-19. So with that, Zindi Africa and then ourselves, we took the angle that what if we had hackathons related to this and have developers also develop detection models for TB or TB-related damages. So we did this. We had over 300 data scientists from across the African continent participate in this. The final of this was just recent, and then the winners will even be announced quite soon. So yeah, there's been a lot of solutions that have emerged from Africa. It's really been impressive seeing young Africans show up when their continent needed them the most. And in some sense, I agree that the projections as far as what's going to happen in Africa were exaggerated a bit much, but also it was precautionary. We did not know what would happen. And the reason why the numbers have not gone as much as they have there are a lot of factors at play. There's even the biomedical science of this, where clearly it shows that people of African origins or ethnicity there's a paper that goes into even genetics, and then maybe even pre-exposure to other pathogens, and there are a number of factors at play. But then it's always good that people were being precautionary and government acted way quicker than
even say in EU or in the US. So it's better to expect the worst and be prepared for it than to have a very casual approach, and then things would have gotten out of hand.
All right, because you just talked about it, I'm going to ask one more question from you. Like you mentioned all the factors that perhaps Africa has been more resilient, like obviously than predicted in the beginning. Could it be also that you've as a continent have had other not super recent but still quite recent learnings from other crises and diseases like Ebola, for instance? Was there something learned from that as well, so the response was quite quick? I remember specifically I was in Uganda when the whole breakdown of the world happened, and when I was traveling in Europe, I didn't have this thorough checking yet, and temperature measuring and hand sanitizers all over the cafeterias and grocery stores, and checking the temperature in the hotels and everywhere. But over there, it was really spot on, social distancing as much as you can, but it was quite spot on. And I would say it was way earlier than in Europe. So Darlington, just recent learnings from the other crises as well, perhaps, or was there something particular you would like to highlight?
Yeah, I think you are right, but then that is mainly in connection with specific countries. So Nigeria, for example, had to prepare a lot towards Ebola, and WHO kind of applauded them by saying that their preparation also helped with COVID-19. The same might be applied to about 4 or 5 different African countries that were heavily hit with Ebola. But then a country, for example, like Ghana had basically we had no experience from Ebola. And so therefore we were very much not so prepared, at least from the Ebola point of view. But then again, if you are talking about infectious diseases, unfortunately, Africa has been hit with infectious diseases for quite some time now. So maybe that also plays some part in it. But I think one very, very key factor is just from a timeline point of view, when African countries responded to the pandemic. So when it started with the early cases in Europe, we did not know the severity of COVID-19 yet. By the time it made its way to Africa, African countries had seen how troublesome the virus could be by looking at Europe, Asia, and even the Americas. So based on that, they realized that, okay, we need to take this seriously. And so they were willing to do certain things like close off the borders. Some of these decisions that it took longer for Asia and even Europe to kind of take. So it's interesting that from an epidemiological point of view, certain decisions like this, just making them even a day earlier or a few days earlier can make tremendous changes. But the biomedical aspect of this is also very interesting. Yes, it's not fully understood yet, and it might take a few months or years to understand it. But from a few studies so far kind of showing the direction that it might have to do with either certain vaccines that people in Africa have had to take in protection against other infectious diseases. It could be related to medication for malaria, but it could also be related to genetics. So yeah, Africa for the most part has been spared. I can tell you for a fact that in Ghana, people live their lives normally now. It's COVID-19, it's kind of non-existent. Yeah.
Very good to hear that. Anne, you have been on the background for a while now, and we have covered the topics here and there. Do you have any favorite tech solutions that popped up during the COVID-19 as a response to COVID-19?
Yeah, sorry.
Yeah.
Yeah, definitely. I mean, like maybe a more famous example, I really love and use the WHO WhatsApp, basically, which is developed by Precold in South Africa. I think it was a very fast response, and I knew Precold before already because we do collaborate with them on some projects. And it's a very simple tool, but it was so helpful and impactful to see and to ask questions and to really make it available to everyone who has WhatsApp, which is of course a huge population. So I think that was one of my early favorites. And what I also saw is that many people tried to jump on this and try to help, which was amazing. And what I really liked were the approaches that were very specific to certain chronic diseases, because of course a generic COVID app is great, and tracking COVID cases and how to get vaccinated in the future, like these are very essential parts. What we try to do with our company as well is really look, what is the impact exactly of COVID on, for example, maternal health, or for example, on HIV. And instead of using a generic app that would fit all, which obviously is not the case, we started implementing modules that would really target that population. And for example, in maternal health, there were a lot of challenges that, whereas for example in India, where I have experienced in the past, a lot of women actually gave birth in the hospital, and now you suddenly saw that, you know, reverting, which is in that country really an issue. So how do you prevent that from happening, or how do you make sure that during the antenatal care visits, actually people still got these visits, got their supplements, got the tests done to make sure that they got the information that they needed. And I think these specific modules there via the channels that you already have were very helpful. And we saw that with a lot of different companies also taking that approach. And I think one really crucial example that we saw that had a direct impact because of COVID was the distribution of medication to HIV patients. That just completely stopped. And obviously that's a huge issue, because, you know, then they get back into being able to infect others as well. So how do you make sure that in a lockdown where you're not allowed to move out of your house, that these people still got their medication, which is so crucial? So developing applications for that, or just putting it on top of the applications that are there with location tracking, and making sure that this delivery could happen at exactly the right moment without, you know, still taking distance, etc. I think these kind of applications for me were very good to see, besides the generic COVID applications. So, and I know there are many examples everywhere of that, but I really try to really focus on those instead of the generic ones. Yeah.
Mm-hmm. When we spoke with you earlier this week, we also touched this topic a little bit that I'm going to open up next. But just it doesn't have to be now, like the answer doesn't have to be from the COVID-19 app or tech solution perspective. It can also, like, how do the businesses, how do the solutions that have been built during the COVID-19 or any social good businesses, how do they actually manage to cope, or what will happen with them afterwards? You know, how do they keep themselves financially sustainable? How do you see that, Anne, happening?
Yeah, I mean, it's a massive struggle, right? Even before COVID-19, developing digital health applications, especially in developing countries, where the willingness to pay or the capability to pay for health solutions is minimal. Like, how do you build a business out of that? How do you get that skill? How do you find the payer? It's very clear that there are beneficiaries, and there are a lot of beneficiaries, but often the beneficiary is not the one who pays. And that problem in healthcare, in digital healthcare, is one that existed before COVID for a very long time, and which really is a struggle, because there are a lot of good social entrepreneurs that want to do well and said, like, okay, we have this amazing, you know, solution that works in this market, and we have so many users, and then somehow you see it changing into an NGO because the business side is not coming in. Like, who is paying? Is that the government? Is that grants, which is not sustainable in the end? The grants, even the government is hard, right? Sometimes, but letting hospitals pay, or an insurance system that might not even be existent pay, or the payer who is not capable to pay. Like, where do you get your money from, and how do you make yourself sustainable? And I think with COVID, we'll see the same. With the COVID applications, we'll see the same. There are many, right? B, of course, the need afterwards will reduce. Maybe if there's another flare-up, they can sustain. But how do you then turn that into A, a solution that is still needed and used, and B, who's going to pay for it? And with our solutions, we've been struggling with that from the beginning. And what we found is that maybe it's not always the popular, choice. Like, if you cannot find a payer in the local market, maybe there's a payer in another market. And that's the approach that we did, for example, where we've developed our tech in India for India. And then we've looked, okay, but right now the market is just not there. Like, healthcare providers cannot pay. The insurance system is not existing. Payers do not have the capability to pay. Grants we have, but that will run out at one point. So we instead looked at the European market and said, we have this great platform. Who can actually use it in Europe as well and can pay for that? And with the money we earn there, we invest that back in. And I think that every tech company in healthcare is struggling with that, also in Europe, also in the United States, because the market, the social, like, or the willingness to pay, the market set up for digital healthcare applications is right now very limited existing. So it's definitely a struggle. Now, I'm interested also to hear, like, what Samir, because you have looked at so many startups in Africa, like, how did you see that with the different startups? How did they make themselves sustainable?
Darlington and Samir, how do the tech startups in the healthcare field make themselves sustainable? It doesn't always have to be like startup, it can be social good business, but how do they manage to cope? How do they find the funds to go on longer and do this good for a longer period of time? Do you have any good advice there? Because there are lots of hackathon teams at the moment who are facing the same problem in the future if they continue their prototype into a product.
Okay, so first of all, I would like to say and join what was previously said with Darlington about the previous experience and the Ebola experience, and because sometimes people forgot what happened, and just to give you if you go back a few years ago, we must remember that in Nigeria, the response and the digital response was quite remarkable, as the country was able to eradicate the Ebola disease from its world territory, not just Lagos, in less than 100 days. Actually, it took 93 days. And it was made possible using a technology application to track down cases, report the spread of the disease, and reduce the time necessary to take care of patients from 6 hours to 1 hour. So yeah, Ebola was one of the first time that technology was used as a massive tool to limit and manage a pandemic, especially on the continent. And when the COVID-19 came, the populations were already ready and they already had this kind of experience. So about your question, how to make this kind of innovation sustainable. So I can, of course, that we know that, and many studies have shown that many companies will struggle this period, and the dead valley, as we call it, is a tough reality for young startups in everyday life, and of course, with the COVID, with all the lockdown that were imposed on the economy, it's really going to be a tough time for innovation and startups to scale up. From our experience at Emerging Valley, we have developed a program, and we work in partnership with the Agence Française Développement, Investisseur Partner, which is an investment fund, a Kenyan company named African Management Institute, and Scale Changer, a French company, a program named the Social Inclusive Business Camp, which is an acceleration program. And each year we source and accelerate 60 African entrepreneurs with coaching, with mentoring, and this year we have a special focus on resilience. and we help them to scale up and we work on their investment readiness and get ready to raise funds. And we have just developed also another program named Emerging Mediterranean, which is specifically focusing on the Mediterranean region. And definitely, what I would say is that the entrepreneurs are on the ground right now to develop solutions. We have more and more programs to help them develop solutions, but there is a missing link, and I'm pretty sure that the panelists will join me, which is the support from the government. The government must not ignore what's happening on the ground. And in France, for example, we have many support programs for SMEs and for startups. The French government has spent a lot of money for the French tech ecosystem here in France, and African startups, they also have to be supported by the governments and by the. We need Pan-African program, massive Pan-African program to support the ecosystem. And I'm happy because actually the African Union and European Union have just launched 2 days ago a massive program named the D4D, Digital for Development, that aims to develop a Pan-African digital single market. And I think this kind of, because if you look at this pandemic, of how huge it is and how big it is, I think we need this kind of Pan-African massive response to support entrepreneurs. It cannot be just local support. It must be a Pan-African support if we want to really push forward the African tech ecosystem, especially in these difficult times.
But is government support really the only way there to grow? Because I agree that, like, ideally, especially in Africa, there's a lot of public health, thankfully, available. But like, in my experience, government funding is not something that lasts. Like, as a company, as a social entrepreneur, you need to find ways as well that do not make you dependent on government funding, because A, it's a very slow process, are going after that pool of money, and C, it's very dependent on the political landscape at that moment, or the economic landscape. So how, as a company, do you make yourself not completely independent? That's unrealistic, but also open up other revenue streams, for example, or funding streams than the government? Because when I talk to startups and especially in developing countries, that's always something that I stress, is like, look beyond government. Look also at other ways, and what are your opportunities there? Because if everyone goes after the government money, like how will that work?
Yeah, government also runs out of money, right? Tarlington, do you have any like I completely agree. I completely agree there. Of course, there has to be a government support, right? But you have to think beyond that. And even as a do-good organization, how can you do good for longer if you're just asking for the government money and not really, or applying for the tenders, grants? But yeah, they do run out like Anne just said. But Tarlington, what's your advice there? Do you have struggled with it personally as well, building business?
Yeah, so almost literally everything that was said by Samira and is definitely something that we have a lot of, we relate strongly with it. So I very much agree. So kind of tying this also to the earlier question, I think we need to be a bit more realistic in how we look at the solutions that have been developed towards COVID-19. Realistically, a lot of them cannot be applied beyond COVID-19. There are also a whole pocket of them that can be adapted towards other infectious diseases or even beyond. So if you ever did something for tracking or just disease monitoring, self-assessment. You can use this towards other infectious diseases. There are endless infectious diseases attacking or impacting Africa, malaria being a strong one. It's been troublesome. Years have been dedicated to eradicating malaria from Africa, and it's still an ongoing problem. So a lot of such solutions can be used towards it. Interesting enough, there's a project that we are doing in partnership with Imperial College London with funding from UKRI. The original submission, we did this before COVID-19, it was towards malaria. So it had to do with handheld molecular diagnostic devices. But then COVID-19 hit, and then you realize that this same technology is adaptable to COVID-19. So in the same sense, post-COVID-19, you could take those diagnostic technologies and use them towards other infectious diseases or even non-communicable diseases, and even beyond healthcare as well. But then again, to go back to the earlier point, there are certain solutions that will just not make it past COVID-19, but then they did serve a key purpose. On one hand, the point being made also is that government has been reluctant towards supporting this, funding being one, but just even from a regulatory point of view and then policy point of view, having the right ecosystem in place, a lot of governments have been lacking behind. So these tools that were developed towards COVID-19 have achieved one point of proving to a lot of government that digital tools are essential to healthcare. So from this point going on, it will be difficult for anyone to diminish or minimize the importance of digital tools when it comes to healthcare. And that is in itself a very strong point. But then also connecting to the point of sustainability and funding, definitely a challenge. It will go back to the point that if you're trying to solve a tough problem, you have to be in it for the long haul. You cannot just, monetization might not happen immediately. And we have to have structures in place that allow for that. So in the US, you have people working on very much moonshot ideas, especially in healthcare. And you try to get a lot of funding for it. That's just the reality. If it's non-equity funds, that's great. It could also be equity funds. But then there needs to be support that allows you to solve these problems in the long term. Even outside of healthcare, when you're looking at certain things like self-driving technology, there's still very much a reality. If you come into healthcare, there are a lot of, so what's the name? Google DeepMind, even though it's taking a research focus, they try developing some solutions for the UK markets too as well. You realize that even though they are leading, they are doing fantastic work, most of these solutions cannot necessarily be monetized today. But then again, we have to understand that these solutions are necessary. So we should have structures in place that extend this project. And so grants are not sustainable. They are not going to last forever. Each organization should have a strategy of what is our plan of making it out of depending on external funding, be it equity or non-equity. What is our plan towards monetization? Maybe if it happens that whatever solution you are developing, some solutions also cannot just be monetized. That is also a reality. There are a number of things, even outside of technology, that if they were monetized would be quite destructive. But then some of them also requires government subsidies. There are a lot of complexities to this that will need to have the right structure. And so it's good that we are having this conversation. More of it needs to happen, especially at the government level, of saying that now that we've recognized the importance of these solutions, how do we put in the right structure to ensure that and also one key lesson in there is that whenever you try to force monetization, it becomes extremely dangerous, especially in healthcare. At this point, there's no need to not mention the name of this company, Theranos. We all saw what happened. So healthcare, unlike a lot of sectors, this is one of the lessons we had to learn. If you are developing an agriculture finance, you can easily go or quickly go from prototype to something that you give to users that, hey, give us feedback and we'll keep improving it. And even we might monetize it whilst we know it's not perfect yet. And that's mostly okay. In healthcare, depending on where you fall between that healthcare value chain, you might not be able to do that. You might even need regulatory approval before your solution can be ever used with patients. And so when you try to speed things up in the hope of monetization for sustainability, then you end up with a situation like Theranos where you've now put human life in danger. So these are all key angles that we'll need to factor in going forward.
Thank you for a very good and thorough insight on your behalf, Darlington. So just to pull it all together, you can't always monetize every healthcare solution. Like you said, it can be dangerous in some cases, and you certainly can't rush it, right? But even when building these new technologies and solutions, you still should consider already the structure and the frame of monetization from the very beginning, just to make sure that that you don't struggle or like you don't start inventing things on the way. So just keeping that business plan in the mind from the very beginning. We're running out of time shortly. Actually, it went faster than I really thought it would. We have kind of drew every panel together with a question: what do you suggest to the hackathon participants? What do you wish to them? And Darlington, because you were the last one and you're also a participant, can you say a few words about that?
To you. Yes. That's putting me a bit on the spot. Yeah. So my advice to myself and other participants would probably be, so even though this is mainly starting from the idea end, we should also be doing this, especially in the context of Africa. So if you are developing a solution that is technologically and even from the idea level very impressive, you should already start thinking in the context of what does this mean in Africa or in the ecosystem? What are the existing structures? What would they allow for and what wouldn't they allow for? This does not necessarily mean that go for simpler solutions. As some people might advise you that, hey, it's Africa, so just do a USSD solution or something simpler. Don't do that. You can go for the complex one because they help you to solve tough problems. But just think about how to contextualize this advanced technologies in addressing these solutions, these problems too.
Thank you and good luck to you participating at the hackathon. Hope it works out well for you and for your venture. Anne, what are your advice? What is your words of advice to the hackathon participants?
Yeah, I think for me, what I would really recommend, and I recommend that to every startup in healthcare and especially in developing countries, who is your beneficiary and who is the payer? And like related again to the sustainability question, but sometimes these two are very different, and that means your solution or your product needs to be capable of serving two quite different needs. And looking to that from a very, very early moment and developing a value proposition for each of these, I believe is crucial. And that's what I would mainly urge all the people that are currently working on their idea. Like, don't look at it from one side. Don't just look at it from the beneficiary side, but also look at it from the payer or from another stakeholder side. And what do you offer them? And really make sure that that value is clear and, if possible, even willing to pay for or really willing to use as well. So that is something that I would really stress.
Samir,
Yes.
your words of advice and closing.
So yeah, I would say, of course, to find no copy paste from, but find solution, grounded solution for local problems that can solve the healthcare problem on the ground, but also, and we have seen it with the pandemic, think that we are now have the same problem elsewhere, and the problem you're cracking related to the COVID-19, it could be used not just on the African continent, but I've just mentioned this Kenyan application. It's now used also in Europe. But my previous point about trying to get the government support, and it's also an advice, I would say that it's it's impossible to avoid it on the continent. And at least if you want to scale up, and if you want your healthcare application, or it could be a fintech solution to get on scale and to have an impact, you have at least to make a partnership with the government or to be endorsed. And I would say, for example, in Togo have very massively innovated in the few months, actually during the pandemic, during the lockdowns, by creating their first system of universal solidarity income. We are talking about it in France for 10 years. We have not developed it. In Togo, they have created a mobile payment solution to help workers in informal sectors in extremely precarious situations due to the lockdowns and curfews, and they choose the mobile money to send them every month cash transfer allowance. And it's the government of Togo, but they worked with the local innovation and local startups and local entrepreneurs. And the impact was massive because they reached many people on the ground. And in Morocco, they are testing also this kind of innovation. It's named Moussadana in Morocco. But my point is that you're solving the problem that your government is also trying to solve, and it's better to work and to get the support of the local authorities if you want to scale. You have also in Cameroon e-health startups. I follow since 5 months now. It's really scaling. It's Gifted Mom, and the first move they made, because now they are reaching millions of people. They help to reduce death mortality for women giving birth. And the first move they made is to make a partnership with the local region, the local governorate. And it's essential on the ground. You cannot avoid the government. And also the government has a responsibility to buy, to support you and to become your clients if you want to make revenue, especially on the healthcare. And Daryl Point made a very good point. It's very difficult to monetize in the healthcare, and the partnership, public-private partnership, is really essential.
Thank you so much. So pulling all this information together, focusing on the problem deeply before rushing towards the solution, getting to know your beneficiary, working with governments from the early on, making sure that you're solving a bigger problem and that you understand, of course, your problem very well. But that's it from our behalf. Good luck to the hackathon participants. Good luck to you, Darlington. Thank you so much for joining us this morning, Anne, Samir, and also Darlington. Yes.
Thank you, Mary.
Thank you, and have a good day. Bye-bye.
Bye-bye.
Bye.
Okay.